Pretty shocking statistic. Every day, 130 Americans on average die from an opioid overdose. That's according to the CDC.
Now, to fight that disturbing trend, an innovative San Francisco program is turning to another drug.
Marijuana. But does it work? KPIX 5's Sharon Chin investigates in tonight's original report.
After breaking his neck in a car accident out of state, Nicholas Olson says he got addicted to prescription drugs and heroin.
I tried outpatient treatment. I've been to other inpatient programs. I just never got anywhere with any of it.
His research online led him to a unique substance abuse treatment program, Remedy Recovery, in San Francisco's south of Market.
I thought, wow, this is great that this is an option now.
It replaces cannabis for opioids.
It's a game changer.
Joe Schrank, the clinical social worker who founded Remedy Recovery, says cannabis offers a more compassionate way to detox.
People being able to sleep while they're in withdrawal and detox is a huge benefit. It's the best thing for people who are detoxing, and cannabis lets that happen safely.
Nicholas uses a vape pen 2 to 3 times a day under the guidance of his doctors and therapists and takes care not to drive under the influence. He says cannabis frees him from debilitating neck pain, anxiety, and insomnia.
I have the opportunity to go to job interviews and to meet people and network.
Schrank adds, cannabis is safer than opioids with far less potential for a deadly overdose.
There are examples of people who have had accidents while under the influence of cannabis, but the misuse potential is extraordinarily low.
In fact, the Journal of the American Medical Association reports in states that legalize medical and recreational pot, opioid use is down 7%. And fatal opioid overdoses have dropped nearly 25%. But skeptics say it's not clear if cannabis is the reason for the decline.
There is an example of...
Clinical psychologist Dr. Danielle Ramo is a UCSF psychiatry professor and research director at the Hope Lab for Teen Health.
There is some promise in that area. However, the data really aren't clear enough, and the studies aren't there to be able to recommend cannabis as a treatment yet.
Dr. Ramo says a person could be trading one addiction for another.
My concern would be that it's possible that people would only be using marijuana for a little while and then relapse to heroin might occur, or relapse to prescription opioids might occur.
As for Nicholas, he knows cannabis isn't a cure for his opioid addiction, but he believes it's a good start toward a more hopeful future. Sharon Chin, KPIX 5.
As you heard the doctor say, there is very little bona fide research on whether cannabis helps with the opioid addiction.
It's partly because marijuana is still illegal under federal law, so federal grants won't pay for the studies.